When it comes to organ donation, there's so much to learn and people out there who are ready to educate. Representative from the Louisiana Organ Procurement Agency, multi-ethnic specialist and educator, Christy Gotro is here to tell us just what we need to know. Christy, thank you for joining us on the couch.
Thank you for having me. I'm excited to be here.
Awesome, we're excited to have you. You have a heart literally on your chest.
Literally, yeah.
Tell me about LOPA. What is it?
So LOPA is Louisiana Organ Procurement Agency. They started back in 1988, and we handle all things organ, tissue, eye donation after death. And so we have our recovery center. It's like our heart out in Covington, but we service the entire state.
LOPA seems very purpose-driven. Tell me about the why of the organization and your why. How did you get involved?
So LOPA's why is to make life happen. It is to take from one life, and not really take, to recover from one life the gifts that the family gives in order to make life happen for another family, right, for the recipient. For me, it's personal because I'm a living organ donor. And so over 15 years ago, I decided to say yes to my husband, who wasn't my husband at the time. We weren't even boyfriend and girlfriend at the time. We were friends, and I just wanted him to feel better after learning he was on dialysis. Finding out what it was. Originally, I didn't even know, what was really going on. But then once I learned more about it, it was kind of like, oh, well, if I can live with one kidney, I'll just give you one of mine. Like, just as simple as that, right? Just saying yes. And I saw how it preserved his life. He didn't know if he was going to be able to have kids. And we had 3 biological kids, and he got a bonus one because I already had one. He didn't know that he would even be married, And so seeing the marriage and the kids and the vacations and being able to not have to go to dialysis, those things for me personally were like, I did a really good thing, it preserved somebody's life. But then when I met LOPA last year, it like tied into a bigger purpose. It was like, okay, there are other families, other people who are saying yes to extend the life of someone else. And so, like you said, it's full circle. That heart comes back around, saying yes is, what I like to tell people, it's perpetual, right? Because it's a part of someone's legacy. My husband did have 3 biological kids, but 2 of them are sons, they're boys. And so they will carry on his name and carry on his legacy because I said yes. And so a lot of times it's not looking at the loss, but your why should be looking at the gain and the generations to come and the anniversaries and the birthdays and, the babies being born and things like that. And so what LOPA does and what I decided to do is definitely making life happen for generations.
And now you're getting the opportunity to spread that education to so many more people who, like you said, may not even know that this is an option.
Yeah,
multi-ethnic specialists.
Yeah.
Tell me about that.
So the disparities in the multi-ethnic community in the state of Louisiana are disproportionately higher across the state, right? And so in the southern region alone, heart disease, diabetes, high blood pressure, the statistics, the percentages are high in the multi-ethnic communities. But for the state of Louisiana, there are over 2,000 people waiting on organ, like life-saving organ transplants, right? But out of the 2,000, we make up 68% of that waiting list. And of that 68% of the waiting list, the majority are kidney patients waiting, right? And so when you see the need, you got to meet it. It's like, what do we do? How do we inform them? How do we educate them? How do we get out there? And it's like, let's create a position and let's target those areas because people are dying and we want to save lives. When we say we are making life happen, we're trying to make life happen for everyone. And so where we see the need is where we've decided to go.
68% multi-ethnic communities. There's got to be something blocking them from donating outside of knowledge. They may know a little bit and not actually know. What are some of the myths?
That's definitely why, well, one of the reasons why the number is high is probably more health targeted is why the percentage is so high, but it's definitely some myths. When I'm out in the communities, a lot of times I get, oh, I'm not going to put that heart on my license because they're not going to come save me. That's number one, right? I hear it all the time. And I tell people, when the EMT arrive, they're not looking for your driver's license. Their job is to save your life because then their job is on the line if they don't save your life. If they don't do everything they are trained to do to save you, then you never make it to the ER. And when you get in the ER, they're not looking to see if you got a heart on your driver's license. Their job is to save your life. If you talk to an ER doctor, if you talk to an ER nurse, their job is to make sure they stabilize you. And even when you move from the ER to the next part, their job is still to sustain your life. And so we don't come in until everybody has done everything they're supposed to do. And one of the main things that I have to tell people is we don't take all deaths. Not everybody can donate. Just because you're dead, it does not qualify you to be an organ donor. You must die of brain death. And then there must be 2 neurologists that say, you know, yeah, they're definitely brain dead, there's no activity. And if you die by heart, like if it's because your heart stopped, then you become a tissue donor. You're not necessarily qualified to become an organ donor. So there's so many other things that go into it. And so I like to tell people, you know, even if you don't put the heart on your license, tell your family about it. Talk to your family about it. Go to the registry itself and register. Go to lopa.org and register. Use your LA Wallet, you know, LA Wallet and register, because it's really about if you want to save a life. Do you want to make life happen for someone else? And not thinking about the loss, and definitely not doing anything out of fear because you think they're not going to save you. And then I think another one is not sure if they're going to be able to have like an open casket. I like to remind people that we have so much technology these days and so many new innovative ways to help the body. And it's the same for after death. So even when we recover organs and say we do like tissue, and when we remove bone, there are prosthetics and things put in place. We have a team of people who are really great at what they do, and they will stitch them back up, and you'll be able to have that open casket funeral, you know, that you want. And so, and in some of the myths, there's always just the lack of education, I believe.
And so what goes into LOPA deciding what kind of education to put out to the community? And if you were talking to residents in Ascension Parish and Louisiana and beyond, that 68% really who don't know, and more than that, yeah. What is the key elements of education, the simple 10-second conversation that could happen?
Why not? Why not? If you needed it, then what would be your response? You know, it ties back to the why, and the why ties into a question. Why not? Why not take care of your organs and take care of your health so that you don't get on that waiting list, so that you don't have to get on dialysis, so that you don't have heart disease and you need a heart? But then at the same time, why not consider just saying yes because you have a healthy body? Or not even if you have a healthy body, because you know someone else may need it. Just asking yourself, you know, why not do it? And then thinking about if it were you and if it were a family member, if it was your aunt or your child or your husband, you know, and then just going from there. And that's kind of how we target our education. It's knowing what the needs are, understanding the lack of education maybe, understanding what, we even single it out to the zip codes, because we know where the true needs are, and going there to say, these are the things you can do to get healthier. These are the things, right now we have a Health is Wealth initiative that just launched last year in Shreveport, and it'll be coming here to the Baton Rouge and Ascension Parish regions here. It is to educate the community on even organ health. Going to your doctor, understanding the medical terminology, asking the right questions, knowing what it is that you need for you and your family, so that you don't become the one that needs. And then at the same time, understanding there are people who need, and saying, okay, yeah, I'll do it.
That's wonderful. And
Yeah.
you tell me that even at the state level,
yeah,
there's some moves being made to push, you know, just the education of organ donating and the things that LOPA teaches forward. Tell me about that.
So I would say for the multi-ethnic community, it's going into the schools right now. We have last year Allie's Law passed, which is she was an organ donor, and they didn't really know much about giving and things like that. And so her family just kind of educated themselves on the whys. Why should they? You know, what happens? How does it benefit another family? And then they really push the education for students. When you go into driver's ed, they have like a very short, you know, part of the curriculum that they go over to educate the student on organ donation. But when you go into the Office of Motor Vehicles, the conversation is very short. They usually just ask, you know, if you want to be an organ donor. You may get a little bit of information there. But the education really is given, I feel, should be given at a very young age so that you understand what all of your organ functions are and how they can help you. Then once you understand how they can help you, it's how they can help someone else. You can't really teach values outside of the house. It's usually left up to the parents. But LOPA likes to go in and kind of piggyback on the value system that parents maybe already have in place, but definitely starting at a younger age to at least teach or give the education on how it benefits. You know, they may not genuinely want to do it, but once they have the education, it may be, okay, well, if that's what it does for me, and then I know that someone else's body may not be operating the way it should be, and I could possibly, you know, be the one that helps them, then they go into, you know, saying yes. But definitely starting the education at a very young age. And we have like a transplant science curriculum that we use, and we kind of cater it according to the age groups, right? And so if it's a very young group of kids, it's really just talking about this is what a heart is, this is what, you know, these are what your lungs are, and this is what they do. And then we move up, like middle school, they get a little bit more detail. And then high school, it's, you know, all of the functionalities, but at the same time, we also go into like the statistics of, you know, how many people are waiting on this specific organ. And, you know, even with lungs, we have a set, and you have two of them, but you may, you know, one recipient may receive one and another recipient another. And the same with the kidneys, you have two, but one, you know, one goes to one recipient and one goes to another. So when it's high school, it's definitely getting more into the details and helping them understand the functions and then the benefits as well. But yeah, starting with the younger ones and then having them to have the conversation with their parents.
So when all this education takes place and maybe someone gets to the point, I think I want to give that yes, or I'm close, but I may need a little bit more of a push. What is the sign up process? Is there, I'm almost there, let me just learn a little bit more.
Yeah.
How do they sign up? Where do they go?
So they can go to lopa.org. We have all the information that you need at lopa.org. But then too, use your Donate Life, use your Google. I like to tell my kids, if you don't understand it one way, then go and be very specific and put it in another way. So if you go to lopa.org and you want to see different stories, we have them there. But then you can always use Google to put in another story in another state. You know, maybe you want to know of a story that's similar to maybe a family member story. You want to be very specific. Go and find the stories. The stories always hit home for me. I mean, I have my personal story, but since working for LOPA, hearing the stories of the recipients and the donor families, it's like I want all my family, you know, to be organ donors, even though they don't all agree. My 10-year-old told me, he was like, no, I'm not going to donate. I'm going to keep my legs so I can walk around heaven. I'm like, okay, but, you know, not everybody wants to say yes, but when you hear those stories, they touch you because the families sometimes have a hard time closing. Usually the accidents are sudden, right? Their family member is taken away suddenly with accidents. And so they don't really have that closure that they wanted. But when that heart is transplanted into another person and they can put on that stethoscope and then they can listen to the heartbeat, it's life-changing because you see the tears and they feel connected to the person. We've even had stories of people like starting to crave food items that their donor, you know, would crave, or starting to be open and like new things that originally they would never go into, right? Because of, you know, that transplant or them feeling connected in some way. And they become families even, like the recipients and the donors, they get together on holidays, they celebrate birthdays together. And so just those stories are everything. And I think that it all encompasses, right, that making life happen. It all just kind of comes together with that, but definitely a story.
That is beautiful. I love the idea of a family being able to gain their loved one back in a different capacity.
Way. Yeah.
That's awesome.
Yeah.
So if anyone in the community wanted to be able to reach you for outreach, education, a health event, how do they get in touch with someone coming from LOPA to kind of spread that wealth of knowledge?
I'm going to circle you back to lopa.org. You go onto lopa.org and they have where you can request speakers. We have Learn More About Everything. It's the health and the wellness. There's Learn More. Education for the teachers and the students. There's a learn more button in alopa.org, but definitely requesting speakers as well. It's the same thing. And for your region, right? Because you may not be in Ascension Parish. You may be in East Baton Rouge Parish, Louisiana Parish. We have community educators all over the state, and even North Louisiana, right? There's someone in your area that can come out and give the education. And I'm praying that, the circle grows of people who already know that we exist. They already know to go seek and to go and look for us because of the education that's going out.
Well, Christy, thank you so much for joining us on the couch. I learned so much today.
Thank you.
And I think our viewers will definitely learn a lot more from having you here.
Thank you for having me. This is awesome.
All right. Well, thank you so much. And like Christy said, if you would like to learn more, www.lopa.org.